And welcome to Founders Day 2024. I'm Colby Reed, and I am so glad that you've decided to join us for this conversation on our work in the health and environmental stewardship sector. For those of you who don't know, Founders Day is actually a longstanding tradition here at the Murdoch Trust. It's an opportunity for us to reflect on our founding in June of 1975. It gives us an opportunity to celebrate all of the amazing organizations that are doing important work for the common good across the Pacific Northwest. It's also an opportunity for us to reflect on the legacy and mission of our benefactor, Jack Murdoch, and how that has informed the work of the Trust over the last 5 decades, how it informs our work today, and how we believe it will inform our work moving forward. A couple of quick housekeeping items for everyone. This is going to be recorded. We will share that recording with you, and we welcome you to share that with anyone in your network as soon as today's session is concluded. Also, we will have some opportunity at the end of today's session for some brief audience Q&A. So if you have questions about the health and environmental stewardship sector, please drop those into the box. I will tell you now, if your question is our organization eligible for a grant? That's not something we're going to be able to do on a case-by-case basis today. We encourage you to check out our website for more information on that. That all being said and taken care of, I'm pleased to welcome Jill Lemke, who is our Vice President of Grants Management and Training at the Murdoch Trust. She also leads the health and environmental stewardship sector work. Jill, thank you so much for joining us today.
Thank you, Colby.
Jill, I'd love to start kind of at that 30,000-foot view and look at why the Trust chooses to invest our time and resources in these areas. So can you share a little bit more about why health and environmental stewardship are such a priority for the Trust?
Yeah, so Colby, like most of the sectors that we currently fund, they all go back to our founder, Jack Murdoch, and some of the founding principles of the Trust. So Jack valued the idea of investing in healthcare and resources. He personally invested in resources for the communities. For the company Tektronix, he had instituted very generous healthcare benefits to care for his employees, understanding that healthy people make healthy communities. And then in terms of the stewardship, the environmental stewardship side of that title, he was also a passionate outdoorsman, and he understood the importance of access to the natural beauty of the Pacific Northwest, and also understood that stewarding these natural resources are really important. So given those two very important and distinct interests, we'd like to think that Jack saw the connection between those two.
And I love that you talk about the connection between health and environmental stewardship, because honestly, if somebody says health and environmental stewardship, they're thinking, okay, hospitals, very important. Environmental conservation, very important. But are they actually really connected? Both important, but are they really so interconnected? Can you talk a little bit about that connection between the two?
Sure. So I actually see them as they're inextricable from each other. And part of that is in order to live a healthy, happy life, you actually need healthy, happy, and well environment. And so think about the role that being in nature plays on your mental health, on your physical health. We also understand when people don't have access to green spaces, it impacts them. Thinking about the important impacts of climate change that are going on and how it affects so many of our lives directly. Thinking about the changing ocean temperatures and how that impacts our food sources. Think about the rising sea levels that are forcing the relocation of entire communities. We also have air quality degradation from wildfires and the physical impact of these extreme heat events that we keep hearing about. So all of these physical aspects of our life are impacted and are interconnected with the environment that we live in.
And you could also say that, the well-being of the individual, if people are healthy, they're out and engaging in nature, and they're able to enjoy, and they're able to participate, and they're able to take the steps to help preserve and protect wildlife and things like that. So if people aren't healthy themselves, they can't take care of their natural environment as well.
And one of the things I really appreciate that's going on in the environmental stewardship area is the understanding that it's not just about protecting and preserving nature, but it's about stewarding it in such a way that people can engage in it. So getting people who don't normally have access. Think about inner city kids who don't necessarily have access to what we have access to every day, and getting them involved and the impact that that sort of action has on those kids.
Excellent. Would love to start going a little bit deeper into some of those
Okay.
areas, which is one of the benefits actually of the sector strategy that we've moved to, is that we have the opportunity to go layers deeper into the impact of these areas. Would love to start with healthcare. Now, when people think of healthcare, it can kind of be treated as this monolith, right? There is healthcare, but really it requires a fair amount of diversity, specialization, geographic considerations, cultural considerations. Can you talk a little bit about kind of the healthcare ecosystem that we're operating in?
Well, it is so specific, region specific, area specific, place specific, and then the needs in a very rural area vary quite differently from, let's say, a frontier area, even more so rural. Just the lack of access to healthcare. Those needs are very different from an urban area where there may be access, but sometimes use is not there. How do we get people to access the healthcare that is available to them? So it really varies from region to region. What are the resources in the area, and what are the needs specific to that area? So you think about a resort community has very different needs. They've got to have some pretty good emergency facilities to help with all of the things that happen at a resort community where people are out there recreating. So there's a lot of needs out there that are different.
Absolutely. And mental health care also is a real central focus for the Trust. It was a central focus for Jack Murdoch. We did a series of videos on this year, actually, on the work in the mental health community across some different areas. Can you talk a little bit about how mental health plays into that picture?
Yeah, so another way that we need to be thinking about the whole person. And, previously we used to talk about, well, here's the physical health needs of people, and over here's the mental health needs of people. And what I would say is we're learning that again, those are inextricable from each other. And so when we talk about access to healthcare, we're actually talking about access to mental health services as well. And so one of the things that I really appreciate is we're seeing a lot of integration of mental health services into the physical healthcare spaces. So so that we're seeing that, oh, this person actually needs access to some of these services. Well, here you go, it's right here. Now, one complicating thing, of course, is when you are in these rural areas, how do you get, you can't have a lot of mental health professionals, psychiatrists living in very rural places. So that's where things like telehealth and traveling people, people that are there certain times, you've got clinics open certain times. But anyway, very need specific for the different places where people are.
Yeah, and I think it's interesting you talk about kind of you touched on the collaborative nature of healthcare, and how there's all these innovations, and how can we provide that access, mental health, physical health, women's healthcare is another area. How can we help facilitate those conversations? And it seems like that was something that was really important to Jack as well, is how can we create collaboration within our communities? And that's something that we're seeing a lot of. We saw a ton of it during COVID, obviously, with organizations sharing resources. But beyond COVID, there's a real spirit of how can we connect urban and suburban and rural and frontier communities through technology. And can you talk a little bit about how that's coming kind of to the forefront?
Yeah, I would say, let's back up just a second. I think understanding that mental health, physical health, it's a very complex situation. I'm not going to say problem. It's a complex issue. And by complex, I mean there are solutions, but it's complex. And so when you change one thing, there are sometimes unintended consequences. So yes, we're trying to get mental health screenings in different places so that we can say, oh, this person needs mental health services. Well, now we know that there is a need. How do we how do we get those services to those people? So, for example, we just had a proposal by an organization in Alaska where it's one organization where the services are centralized, but then they're feeding and serving smaller clinics from this almost like a hub and spoke model. How does the place where some of the resources are centralized, how do they serve through telemedicine, through mobile units, getting the healthcare resources to those places that wouldn't necessarily have access otherwise.
Excellent. We've talked a lot about the connection that the land on which we live plays into our overall health. Can you talk a little bit more about how the trust engages in projects that impact the environment in our natural region, kind of the environmental stewardship side of the coin?
Well, again, hearkening back to Jack's love of the great outdoors. So I think initially we started, and I can't speak because I wasn't in the original grant making part of this, but just the idea of how do we invest in organizations that are stewarding the environment, and then now it's becoming how do we make sure that, so for example, forests. How do we make sure that we're not just preserving forests, but we are actually supporting organizations that view working forests as an important option? Because that not only does it care for the forest, it also provides jobs for the communities and healthy access to the forests that are being stewarded. So it's more of a holistic approach. And one of the things that's really important about the work in the environmental stewardship area is those collaborative efforts. One of the main questions that we ask an organization that comes to us for funding is, who are you partnering with in the region? And we want to hear that they know the other people that are coming to us for funding. If they can't mention anybody else in the area that's doing some of the same work, we know that that's a concern. And so who are you working with? And increasingly, the importance of working with tribal communities and, listening to the people who have lived on the lands, for thousands of years. How were the lands stewarded when they were the stewards of the land? And so including community voices, government voices, tribal voices, nonprofit, seeing it as a very collaborative and integrated ecosystem.
It's that idea we talk about quite a bit at the Murdoch Trust, is the idea of the unconventional coalition. The groups that maybe are, wouldn't necessarily, vote for each other, if they're on the same ballot or something like that, but they share a common interest on a common issue. And so getting those people around the table, and that's really where the trust plays a role. We're not the ones that are going to go out and direct and say, this is what the solution is for Montana. Right. But we can help kind of play that role as the convener and the connector.
Yeah. And that's beauty of being a responsive funder. We have people that come to us and say, hey, this is a problem we're trying to solve. And then we can say, ooh, do you know this organization? And then connecting them.
You've talked, I really appreciate the detail that you've laid out in these spaces. One of the benefits that we're seeing as we've moved into this sectoral model is we have the ability to go deeper and really dive into long-term impact in some of these areas. As you've been living into this work over the last, you've been with the trust for quite a while, you've had connections there, but really focusing on this specific sector for the last 12 to 18 months. What are you looking to see? What are some things that you're hoping to learn as we lean into this new model moving forward?
Yeah. So one of the things that I'm really starting to appreciate is some of that it's cross-cutting sectoral connections that and when you're not thinking about, when you're just taking a grant and, okay, this is the grant that we're working on today, the proposal that we're working on today, and you analyze it in and of itself, then it's, there are some natural connections. Okay, this mental health group needs to know this mental health group because they're trying to solve the same problem. You make those connections. But when you're looking at a sectoral model, then you can suddenly say, ooh, forest management practices actually impact physical health. And it's like, the only reason we know that is because we're talking to the people in this entire sector. And we're able to see those those connections that we wouldn't necessarily see otherwise. Plus, we're getting to know, identify gaps. And I participate in a funders group in Montana, and one of the things that we're able to do is say, okay, we've actually mapping the resources in Montana. What is going on where? Who are the players, and where are they? And what are the issues that they're addressing? And where are the gaps? Where are those places where there are there's no funders and there's no organizations that are funding there. I mean, there are funders because we're like the state funder, but there's nothing going on there to meet the needs that are there. Mm-hmm. So identifying gaps is another really cool benefit of the sectoral model.
Excellent. We're getting some really great questions from our audience that I want to make sure we have a chance to get to a few of those. Again, if you have a question, please feel free to drop that in the Q&A box. We're going to get to as many of those as we can. This is a question we've heard a few times regarding the sector. I think we've touched on it pretty well, but it's always good to call it out. Do health and environmental stewardship organizations both have to have that in their mission? Like if an organization comes to the Murdoch Trust for a grant, do they have to be serving both health and environmental stewardship, or can it be just a healthcare organization or just an environmental stewardship organization?
Okay, so yes, they have to do all of it. Yeah. No. No, it's a bucket that we're putting it into to say we're going to look at these. Well, there's actually subsectors within the sector, and no. One of the things that isn't changing in the sectoral model is how organizations come to us. We are still a responsive funder, and our eligibility guidelines are on our website, but really all that's done is kind of make it clear what our eligibility is. We haven't really changed a whole lot. We just made it very clear up front. So no, they don't have to do it all.
Excellent. Yeah. One of the things that we've talked about quite a bit, and some of our audience members are curious about, is the idea of healthcare deserts. Mm-hmm. Particularly, you hear about that. You mentioned that you kind of touched on that a little bit when you're talking about the rural and frontier communities, but there's also some of that in urban settings as well. Can you share, first of all, when you consider something as a healthcare desert, like what qualifies as a healthcare desert? What does that mean? And then also, what are some of the innovative solutions that you're seeing to help address that challenge?
Yeah. So just a healthcare desert, by definition, is where there is limited or no access to basic healthcare services. It's a desert. We talk about food deserts. It's the same idea. One of the things that what just popped into my mind was, as I'm thinking about this organization in Montana, where in a small community, in a small neighborhood, there's both childcare, a clinic, and affordable housing. And it's the idea of taking the resources to where the people live that need them, because there's mobility issues, there's if childcare issues. It's difficult for someone to seek healthcare if they're if they have to deal with, where do I put the kids if I'm going to go to the doctor, that sort of thing. That's one thing, is bringing the resources to the communities, and that can happen in urban dense cities everywhere. But the other thing is, in these rural and frontier areas, of course, I mentioned the telemental health or telehealth. There's also mobile units. So for example, we've made several grants for mobile mammography units that actually take the mammography equipment out to the rural areas, so that people don't have to drive 45 minutes or 45 miles, which may not be the same thing, drive long distances to access those sorts of services. So taking things to where people are, taking services to where people are, and then having community areas or facilities that have multiple, one-stop shop for the different things that people need.
Yeah, and those innovations are so have multiple applications. I know we saw, in COVID, one of our grantees that does mobile dentistry. Yes. They converted their mobile dentist units into COVID testing units, and they were going out into rural communities to test for that, which was just really cool. We'd love to go back to mental health for a minute. This question's come in, and again, we touched on this actually in a video the Trust did on culturally representative mental health care, but when it comes to mental health, seeking therapy, mental health services can be normalized and encouraged, or it can be, more challenging depending on the culture in which you were raised and the community in which you were raised. It can be an urban versus rural divide as well. How are you seeing nonprofit organizations address these differences and be sensitive to the context of the people in which they serve?
I think one of the most important things that we're seeing is the including the voices of lived experiences in the development of the services. So, for example, we're seeing a lot of organizations that have people from the communities that they serve serving on their board, serving on advisory committees. Um, Peer support. I love the peer support work where they're taking folks that have gone through the exact same thing, living in those communities, and pairing them up with people who are in the middle of either a mental health crisis or an addiction situation, and coming alongside them and saying, "I've been there.
Mhm.
I, I look like you. I'm from here," and walking alongside them. That's really important. Um, Another thing is bringing, so for some organizations are having like internship programs or um, kind of building their own supply line of the people within the community. So people in very rural areas, if they can do some of their training right there, not only does it serve the community, they are from the community. We see this on some of the reservations in Indian country. We see where there are people being trained on the reservation to serve there. So the people from there, um, programs developed for there, and yeah, so meeting the specific needs of that community.
Excellent. And on that question of collaboration, we actually got a question from Maddie from the Glacier Institute in Montana. And Maddie is asking about how individuals and organizations that want to be part of those collaborations and those conversations, is there a way for them to kind of signal to the trust or, in their conversations with the trust, how do we go about helping make those connections if people are eager to participate?
Yeah. And I think that's, again, back to the beauty of this sectoral model. I would say, Maddie at the Glacier Institute, reach out. I recognize your organization name. Reach out and just say, hey, how can I be involved? And as as a sector, we are becoming aware of, and we're also building collaborations. And so that's a great way to do it. Just contact us and say, who do we need to know? And we know that you're going to bring something unique and hopefully connect you with other people who would benefit from knowing you.
We love playing matchmaker anytime
We
we
do.
We've got time for, I think, about two more questions before we need to wrap up. And I like this one. The trust is a capacity building organization. We're looking for what are the investments. They may not be the flashiest, they may not be the most sparkly, but they're the ones that are going to help an organization really kind of take that next step and create sustainability over time. Are there any recent examples of a capacity building investment, either in healthcare or in environmental stewardship, that you have seen and you're particularly excited about that potential impact or really excited to see what that's going to bring 5, 10, 20 years down the road?
Oh, interesting. Um,
I know we've talked a lot about the, particularly in the rural settings,
Yeah.
those telehealth investments
Right.
that really were starting to gain some traction before COVID, but really in COVID have revolutionized the way that we're doing that work.
Oh, interesting. Okay. So one of the things I think of when you ask that sort of question is understanding that. So, for example, putting mental health providers, resources in the schools. Um, Recognizing that our students were really having a difficult time during and after COVID. And how do we meet those needs? And there's this one, and I think they are, a focal of the mental health videos, where they are actually doing universal screenings at all the middle schools and normalizing the fact that we're going to ask you twice a year or more how you're doing, how you're feeling, and if there are any flags that we need to be aware of, and then immediately connecting them to the services that they need. And that's just a really important thing. Is it's not just identifying a need, but then it is immediately connecting to services.
And again, that's a great plug for the series of videos that are on our website. That story in particular is incredibly impactful as they talk about. That's an organization also that started in just one community, has now expanded statewide. Now they're looking at how they can scale that nationally, which is going to be fantastic. So it's a great example of how a little capacity building investment is having this national ripple effect. Last question before we let you go. You've been very generous with your time today. Any final thoughts or any things that maybe we haven't touched on in these areas that you think would be really important for our audience to walk away with from our conversation today?
So a couple of things. One is we haven't actually talked about two very important subsectors within this group. And one of those is the organizations that serve people with physical differences or intellectual difficulties and differences or neurodivergence. And we still do fund in that sector as well. So I just wanted to say we haven't changed on that just because we didn't talk about it. And the other one is what we call disease support organizations. So organizations that work with individuals or families who are going through or dealing with something such as Down syndrome or Parkinson's disease or cancer. So those organizations that support people going through those health challenges or situations.
Excellent. And of course, people can learn more about this on our website. We have an entire section devoted to the health and environmental stewardship sector. It goes into all the details. So if you're curious about if your organization would qualify for a grant, that's the best place for you to start. Jill Lemke, thank you so much for your time today. We appreciate you.
Yeah, and real quick, thanks to all the organizations out there that do this work, because me talking about it is really nothing compared to what you all do, and just appreciate you so much. Thank you.
Very well said. I want to thank everyone also for joining us today for today's conversation. Again, recording of this will be made available on our website and it will be emailed to you directly. Also the questions that we were not able to get to today, we will be sharing those on our website in some future content. So if your question was not answered, we will be getting to it, I promise. In the meantime, thank you so much for joining us today. Thank you for tuning in, and we hope you have a happy Founders Day.